Welcome everybody to Go Local Live. It's 12 noon. Dr. Michael Fine joins us today. A couple programming notes. I want to thank Rebecca Cotto da Silva for Skyping in from Bolzano, Italy this morning, giving us great insights into how that nation is dealing with maybe the biggest eye of the storm known to man in dealing with just a tremendous crisis, healthcare crisis in Italy. Also at 1 o'clock, Governor Raimondo does a press briefing, and we'll get some new updated numbers. Let's go to Dr. Fine. Dr. Fine, thanks so much for joining us.
Good afternoon, Josh.
Okay, so some of the things that took place over the last 24 hours. Number one is really a guidance from the White House. I think it gets formalized today at their briefing this afternoon that people should wear some kind of cover over their mouth and nose, de facto a mask, although great warning not to utilize those types of masks that are needed by healthcare professionals. Talk about that a little bit.
Well, it makes sense. There's no downside. We've been actually recommending that in Central Falls and Pawtucket for a couple of days now, particularly for people who are sick. We know the evidence is pretty good that people who are sick wearing a mask, it limits the respiratory droplets that they expel and reduces the risk of people around them. The evidence about people who are not sick wearing masks is not as good, but there's no downside. So,
right.
Theoretically, you can understand where that might help prevent some inhalation of some of these viral particles or respiratory droplets. So why not do them? Why not do it? I think the original caution was around taking masks away from healthcare workers. But now I think there are enough patterns and enough ideas about how people can make their own masks that makes it worthwhile for people to do in their own homes. I like the idea of people making masks with their kids as an activity they can do together, and also as a kind of opportunity to teach kids about how viruses are spread and what we're doing together, how to do the things that we're doing and why we do them.
But I want to push back on this a little bit. Almost 2 months ago, the public was raising this question and people were going out to buy masks, and CDC went on national television, healthcare experts went on national television and said, you don't need a mask. Clearly, science has shown, JAMA released a video of how far a sneeze travels, 26 feet. People should have been given warnings and given better education about what the implications of this more than a month ago.
We will have the opportunity down the line to reflect on CDC and CDC culture, which I know a little bit. Remember, CDC also said with absolute clarity that people who didn't have symptoms couldn't transmit the disease. That really made it so that we made a bunch of choices that were wrong. And that comes out of the way their culture works, and I think was very unfortunate. I think this mask advice was unfortunate. We could have done homemade masks a month ago, you're right. But they get a little controlling and they like to control the message and they believe their own propaganda. And
but the CDC, there's enough smart other healthcare professionals across the United States. There's enough research going on at academic institutions. Shouldn't that message have gotten out? Listen, don't use healthcare masks, but do put on a mask, some type of cover to limit both if you are sick, clearly, and if you are trying to avoid it, may have some benefit.
Honestly, I don't think anybody on the scientific side really thought of that. That sort of adoption of homemade masks came by watching what the public was doing and learning from what the public was doing, which goes back to something I've been beginning to think about more and more about how Ebola was stopped in Liberia. It wasn't stopped by doctors and it wasn't stopped by hospitals. It was stopped by communities teaching themselves about how to control the spread of infection. So I think the role of the public in this has been hugely helpful. And, one of the things that people who do what I do need to remember is that we're not here just to talk. We're often here to listen. And listening in this case was very helpful.
That video from JAMA is on GoLocal. You can see it. It is a slow motion video of how far a single sneeze travels. It is quite remarkable. You may never go near another human ever again, regardless of the coronavirus after this. Let's jump over to the numbers. The numbers have some positives in some aspects of the world and a lot of negatives. Let's go there.
Well, this is going to be a difficult period. So, 225,000 people around the world have recovered, but there are now 1,055,000 people with test positive cases. That's an increase of almost 90,000 in one day. We have 257,000 Americans who are test positive, an increase of almost 40,000 in one day. 657 test positive in Rhode Island, with 91 new cases the day up till today, 72 hospitalizations. And the really good news is that we have 14 in the ICU. Nobody wants to be in the ICU, but that number has stayed stable for a couple of days. I assume it's going to go up today or tomorrow, but that it is reasonably stable in the short run speaks volumes about what an amazing job Rhode Islanders have done at respecting social distancing and at trying to flatten the curve.
New York City is on the precipice to their surge. Many hospitals there report that they are just completely overwhelmed now, and that their workers are just simply worn out. They've been at it almost for a month in many hospitals, dealing with a pace of work that they've never experienced or never contemplated in the past. How do these two disturbing trends intersect? Worn out, sick healthcare frontline workers and an ever-growing number of cases and serious cases coming out of New York.
Well, I think we're hearing the governor of New York say what needs to be said, which is we need more healthcare workers there. They're calling for volunteers, and they're doing everything they can to make sense of things. They're actually doing something in New York that I think we're watching, that I'm watching, and maybe a good model and maybe a model for what will happen here. I can't say for sure. But they're building what they call alternative care hospitals. That's what's going up in Central Falls and in Central Park, and that's what's going up in the Javits Center. And what they're going to do, as I understand it, is those hospitals will be used for people who are not sick from coronavirus. And their hospitals will turn into coronavirus hospitals and isolation centers. And it wouldn't shock me if we don't do the same kind of thing here. I'll wait and see, but that strategy makes really good sense. It sort of creates a clean hospital and a hospital that's already infected, and tries to keep infected people and sick people apart, because right now, as you say, everybody's infected, and people are bringing, healthcare workers without meaning to, are bringing infection into hospitals and exposing sick people.
How does the healthcare structure deal with this intersection of the tail end of the flu season? Some people may have flu, think they have coronavirus. They tee up in line to go in. They've talked to their doctor. Their doctor's told them to go to the hospital. They're in queue at the hospital. And in fact, because of the testing, they may or may not be going into the hospital. How do we manage those two elements across the healthcare universe?
Well, I'll tell you one thing that I think CDC did that I think was brilliant, which is to say to people, stay home in isolation unless you're sick enough to need hospitalization. Because we don't really have medicines that make either flu or coronavirus better. We have one medicine that helps a little bit with flu, but it's not a major It's like not the thing that you need to cure it. The flu's going to get better by itself. Most coronavirus will get better by itself. So most of us are safer if we can find an isolated place in our houses. Most of us are safer just to stay home. And that's been the message. I think that's the message we're trying to put out around Rhode Island, and I think that makes real sense.
What's your biggest worry right now as where we are? We're in the first week in April. The University of Washington's modeling says it will peak at April 20th. The governor has not released modeling for Rhode Island, although she said in an utterance that modeling being done in Rhode Island showed a later period of time. What's your worry? Somewhere between April 20th and June 1st is probably our peak surge period. What's your worry on this?
I think my major worry is the height of the peak. Whenever the peak comes, the challenge is, are we going to have more people seriously ill, needing ventilators and ICUs than we have ventilators and ICUs? And will we have enough health workers to staff to sort of staff the existing hospitals, to spell the people who are working their fingers to the bone in our hospitals, and to staff these couple of thousand new beds that I think we're trying to open in a couple of different places as alternative care centers.
And talk about those other locations. Are they in the right places? Are there enough of them? What do you know about this strategy?
I don't know much more than I told you. I've kind of heard that this is where they're happening. I don't know for sure what the size is. I'm hearing 1,500 to 2,000 beds between them. That's really putting a substantial increase into the number of hospital beds, and that's a good thing. What I'm mostly worried about is how we're going to staff them, how we're going to find healthcare workers to go in and take care of the people who are sick.
One of the locations that's been discussed, we've confirmed that they've certainly visited the Rhode Island Convention Center and Dunkin' Donuts Center, that there are National Guard. We've got a photograph of a National Guard vehicle over at the Convention Center. That's similar to the New York strategy of the Jacob Javits Center, correct?
Yeah, that's as I understand it. But remember, I have no official confirmation of this. This is kind of my observation from a distance.
Moving forward, we're going to see this period of time. We know, we were talking beforehand about the credibility of data from China. The New York Times has a significant piece on how the CIA is working functionally overtime, trying to get what they think is the actual numbers. There's missives coming out of China from folks who are putting themselves at great risk, trying to report out that the numbers from the government are wildly deflated, and that the number of deaths and the number of cases are substantially higher. Leaving that apart, there certainly seemed to have been a surge in late January, and then that number has decreased subsequently. That's about a 3-month down cycle. Would we expect, if we see a surge in, just using a stop date of May 1, do we see a downward cycle that takes 3 months here in Rhode Island?
Well, I think you have to assume that the amount of time it took to peak is the amount of time it will take to the word we use medically is defervesce, to sort of de-peak. So if our first case was March 1st and we peak at the end of April, then I think we've got 2 months of letting it settle again before we can really move forward. Depends on when the peak happens.
Is there any data anywhere yet that warm weather will have a muting effect on the spread and on the impact of the virus?
Not on this virus, but remember there's some data about influenza, and in many ways this virus is behaving like influenza behaves, except that we are all susceptible to this virus, and all of us can get it. Now, that's the proviso. So there is no data about this virus that I'm aware of. The virus we have is from flu, And there is some virus that in seasonal, that in climates that are temperate, that the flu drops off as the weather warms up. And there's some experimental evidence that supports that.
Dr. Fine, last word from you. What's your recommendation for folks this weekend as they try and have some normalization of their life during this extraordinary period of time?
Go out for a walk by yourself, but go out for a walk and sit with your kids and make 7 masks for everybody in the household. Have fun with it, make it into a family project, and sort of use them as you think is necessary. And also don't forget to put together a hibernation or isolation room so you're ready when somebody gets sick, because as I keep saying, we're all getting this. And for most of us, it's mild disease, and just remember that.
Dr. Michael Fine, thank you so much. As always, programming note, 1 o'clock, Governor Raimondo's press briefing. That is live on GoLocal Live. Thanks, everybody, for tuning in. We'll be back with more news later this afternoon. There's a number of things breaking. Continue to stay up to date on those. And if this weekend is like last weekend, it will be a very busy weekend. And if it's as busy as last weekend, we will draft Dr. Michael Fine back into the studio by Skype to bring it to you. Thanks, everybody, for tuning in.
Thanks, Jeff.